Hi there, it is Jacob Hoskins here for Treatment Tuesday, and today we are going to talk spiky ball and spiky ball maintenance that you can do for your own self-care, especially in those times when you don't have access to your acupuncturist or your remedial therapist or your osteo, physio or chiro, whoever you go to see. But use these as a way to help you get through those times and keep your maintenance program up, because self-care is the best care, and combined with your therapist's care, it is you got the benefits are going to be tenfold. So go get a few of these, go find which ones you like. This one's a hard one, this one's a super hard one, and this one's kind of a firmish one. You can get all different shapes and sizes, and I prefer big ones for like big muscle groups like glutes, back, shoulders, and good for the IT bands as well. I don't like foam rollers too much. I find them a bit awkward and uncomfortable, so, and harder to carry around. I can put this in my bag, it's easier to do this. So I put this on my IT band. I just hot spot the area where that it feels tender and tight, and I've released that with one ball. So yeah, go get yourself some of these and just test them out. Try not to go for too soft. The soft ones aren't going to give you that pushback that you need to help that tight muscle, relax. So that's my tip on getting a spiky ball. They're cheap, they last forever, and they're going to do you a wonder of health. So just go get them, put one in the car, put one in your bag, take one to work, put one in the fridge. Whatever you want to do, just stick them everywhere, and use them. Don't just buy them and let them hang out, because they're very good for a lot of things. So once you get into the habit of using these, you'll actually start to notice that you actually just gravitate towards it, and you grab it and just start doing this yourself. Build the habit slowly, make it stick. So, okay, I'm just going to talk about, I want to release this tension through here and the back of the neck here. So we're just going to talk about that. This muscle here is your master muscle. A lot of people clench, smiling, talking, eating. So just gently roll it around that area. And you can also feel it roll up through that gap of your jaw into that area there where the actual jaw joint is, and just sort of gently roll it around. Generally, that's enough to get the blood moving and to help it relax a bit. So do that for a little while on both sides. Also come up underneath the jaw, not too hard though, just gently roll it around like that. What that's going to do is stimulate the blood flow, but it also increases that lymphatic drainage through here, and that can get stuck because we have this forward head posture a lot. So that's going to help it drain back down through into this area where it goes back into the system. The other thing you want to focus on is this guy, your sternocleidomastoid muscle, which goes all the way up to the back of your jaw here. This one is very common for a lot of issues. You can get headaches, jaw tension, neck issues. What else can you get? Restricted blood flow. It causes a whole bunch of things, and it has two parts to it, but actually the main reason for its problems is it causes all this tension that feeds in to this master muscle, and that gives you that jaw clenching. So what you can do is just go behind it and just roll the ball up behind to your ear, and you'll feel it fall into a divot just behind your skull bone here. And just gently push into it and hold it for a few seconds, and just work that around a little bit. You might hear a few little pops. You might hear it sort of crunch through the tight muscle band there. Just do it a few times up, and you can just do a little bit behind the jaw as well. Just get into that tendon area where it attaches to the bone, and just give it a nice little stretch. Don't push too hard, just work with what your limits are, and do it for both sides. So you can also do under the jaw a little bit. You don't want to push too hard in this area, it's a bit sensitive, but we have a muscle group called platysma that comes on the forward bit here. And it looks a bit scary, but it can get quite tight through here just because of our daily posture. So just gently push that ball under there and roll it around. And that stimulates the blood flow as well under there. Also very good for the skin. So you've done the jaw, you're coming up the back of the ear. Next we want to go into, see if I get this right, into the back here. You're going into an area called the suboccipital area, which is just, if you come down the base of your skull, there's a bit of a hole and the ball will sit nicely in there. So basically you just want to put the ball in there, cradle it with both hands and just gently pull it in and then roll it around both sides. I like to use both hands and just sort of rotate my head as well as I get through to the bigger muscle groups on the back there. That can be really good if you are experiencing a headache or you're getting that tension feeling coming up your shoulders in through the back of your head there. Just pop it in there and just give it a release. Hold it for 10 to 15 seconds each spot and you'll definitely feel the benefit come from that. That is a very good technique in its own right, just to help get you through the day. If you're having trouble sleeping as well, this can be a good way to relax all this tissue around here that can actually store a lot of stress and nervous energy throughout the day. So that's a good one to do. So that's my tips. That's Treatment Tuesday, something you can do yourself. It's very cheap and effective. I usually give away this one to all my patients. It's a firmer, harder one. But like I said, if it's firmer and harder, you don't have to push so hard. And the reason why the spiky ball is effective is because what it does is when you push down, it pushes old blood away from the tissue. I'll try and show you here. And if you can see, if it focuses, all that old blood gets pushed away, all those white dots, and then all the redness comes back, and that's fresh blood permeating that tissue. So really what you're doing is you're stimulating that area to get more blood flow, as well as relax the tendons and the muscles. When you roll it around bigger muscle groups, you're actually breaking up fascial nodules and fascial tension. So it's going to make that muscle relax a bit more as well. So that's the big reason behind it. Also, like trigger point work, it does help release trigger points. With trigger points, you can have sore trigger points, or you can have trigger points that aren't sore. So especially on an IT band, it'll be sore. If you're working through your pecs, it's going to be sore. So with a trigger point, you want to hold it for a minute to a minute and a half. If it's a really stubborn one, especially like the glutes, glute med or piriformis, you want to do it for at least a minute to a minute and a half. That'll give it enough time for that muscle to switch off and start relaxing. And that can be a good way to get you through as well, especially if you're working out or you've got trigger points from just postural disorders or distortion. Okay, so Treatment Tuesday, spiky balls, go get some. And got any questions, give me a call on 0459 494 969. More than happy to have a chat. And if you want, you can just drop me an email or book in online and come and see me at the Fitzroy-Chinese Medicine Clinic, and we'll get you underway for the new year. I'll be back in track on Friday, so I'll see you then. All right, have a great New Year's Eve, and I'll chat to you soon. Bye.